This is the VOA Special English Health Report. An influential group of medical experts released new guidelines on testing for breast cancer on November 16th. The guidelines are from the United States Preventive Services Task Force. Its members are appointed by the government, but its recommendations are independent. The new guidelines appear in the Annals of Internal Medicine. One of the biggest changes is that the task force now advises against mammograms for most women under 50 years old. In 2002, the group had suggested such screening tests every 1 to 2 years for women 40 and older. The new guidelines also say women between 50 and 74 should not get mammograms every year as currently advised. The experts now recommend testing every 2 years for that age group. The task force says the new recommendations are not meant for women who have an increased risk of breast cancer. The experts also say there is not enough evidence to decide about the benefits and harms of testing women 75 or older. But the group recommends against teaching women breast self-examination. It says evidence suggests that doing so does not reduce breast cancer deaths. Mistaken test results called false positives are one problem, but another problem noted by the task force is overdiagnosis. This is when doctors find and possibly treat cancers that would not have shortened a woman's life. Radiation exposure from breast X-rays is another consideration, though the task force says it may be a minor concern. The task force did not suggest one form of mammography over another. It says there is not enough evidence to decide about either digital mammography or magnetic resonance imaging instead of traditional film mammography. Some doctors say the new guidelines will reduce women's chances of needless treatments, invasive tests, and harm, including psychological harm. But other doctors say they worry that the changes will reduce testing and lead to more women dying from breast cancer. The American Cancer Society says it will continue to advise women 40 and older to have yearly mammograms. But breast cancer expert Susan Lobb says the new guidelines are similar to those of most other countries. And that's the VOA Special English Health Report. For more health news, go to voaspecialenglish.com.
This is the VOA Special English Health Report. A miscarriage is the natural loss of a baby before the 20th week of pregnancy. Experts say many pregnancies end before a woman even knows she was pregnant. Up to 20% of known pregnancies end in a miscarriage. Miscarriages are generally caused by genetic problems with the baby that prevent it from developing. But whatever the cause, the loss of a pregnancy can be heartbreaking. And sometimes the advice that women receive after a miscarriage can also be heartbreaking. Some women are told to wait before they try to get pregnant again. A 2005 report from the World Health Organization advised waiting at least 6 months. Some doctors advise women to wait even longer. But a Scottish study published in 2010 found no need to delay. Researchers from the University of Aberdeen examined the medical records of 30,000 women. The women visited Scottish hospitals between 1981 and 2000. They had miscarriages in their first known pregnancies and became pregnant again. The study found that 85% of women who waited less than 6 months to get pregnant had live births. That compared to 73% of women who waited more than 2 years. Those who quickly became pregnant again were less likely to have a dangerous pregnancy form in their fallopian tubes. They were less likely to lose their fetus after 20 weeks, known as a stillbirth. They were also less likely to give birth by cesarean section, and they had fewer preterm births and fewer babies with low birth weight. The study found that about 40% of women became pregnant again within 6 months. 25% got pregnant within 6 to 12 months. The women who quickly became pregnant again after a miscarriage were more likely to be older. Older women might be less likely to delay because they know there are more risks with pregnancy the older they get. The 2010 report appeared in the BMJ, the British Medical Journal. The researchers pointed out that their results were limited to Scottish records and could not be generalized to all women. For example, women in developing countries start having children at an earlier age than females in Western countries. For VOA Special English, I'm Mario Ritter. Find us online at voaspecialenglish.com.
This is the VOA Special English Health Report. Dementia is the loss of mental abilities caused by brain disorders that affect memory, thinking, behavior, and judgment. The most common cause of dementia, especially in older people, is Alzheimer's disease. It causes up to 70% of dementia cases. Worldwide, an estimated 36 million people are living with dementia. A new report predicts that number will increase to more than 115 million by 2050. The report is from the World Health Organization and Alzheimer's Disease International. The number of cases in the heavily populated developing world is expected to grow as more people live longer. The report says more than half of those with dementia now live in low and middle income countries. This number is likely to rise to more than 70% by 2050. People are living longer because of better health care and increasing wealth. But the report says dementia is not a normal part of growing old. Shekhar Saxena is the Director of Mental Health and Substance Abuse Research at the WHO. He says dementia is often not recognized. It is commonly mistaken for an age-related decline in functioning, because it can mimic age-related problems, and also it progresses slowly. Even in high-income countries, only 1/5 to 1/2 of the cases of dementia are routinely recognized. This percentage is much lower in middle and low-income countries. Martin Prince is a professor at King's College, London. He says many people wrongly believe that dementia and Alzheimer's disease are not problems in poorer countries. He says findings from recent studies in Western Africa conflict with the belief that Alzheimer's disease is rare on the continent. There are fewer older people because life expectancy is shorter. But among people who live to old age, he says, rates of dementia look quite similar to high-income countries. The WHO says treating and caring for people with dementia currently costs the world $600 billion a year. That includes the reduction of earnings for people with dementia and their caregivers. The agency calls for greater efforts to identify dementia early and to educate the public and provide better care. Dementia may be incurable, but health officials say much can be done to improve the lives of people who have it and support their families and caregivers. To learn more about Alzheimer's disease, go to voaspecialenglish.com. For VOA Special English, I'm Carolyn Presutti.
This is the VOA Special English Health Report. In 1928, a British scientist made a chance observation. He noticed that some mold had grown in a bacterial culture plate in his laboratory. Molds can do that, but this mold had the ability to kill the bacteria around it. The scientist, Alexander Fleming, found that the mold was a member of a common group known as penicillium. Fleming and two other scientists, Ernst Boris Chain and Howard Walter Florey, went on to win the Nobel Prize in 1945. They were honored for the discovery of penicillin and its curative effect in various infectious diseases. Other powerful antibiotics have been discovered since penicillin. But many antibiotics have become less and less effective as the germs they are designed to kill develop resistance. So, scientists are searching for new ways to treat infections. Now, researchers in Australia say they have made an important discovery. Scientists at Monash University in Melbourne believe an antibacterial viral protein called Pli-C could be used as an alternative to antibiotics. This protein was first identified as a possible treatment for infections in 1925. But the research ended following the discovery of antibiotics. Now, scientists have spent 6 years studying the structure of the protein. They have found how it kills the bacteria that cause sore throats, pneumonia, and streptococcal toxic shock syndrome. Australian researchers worked with scientists at the Rockefeller University in New York and the University of Maryland. Their findings appear in the Proceedings of the National Academy of Sciences. Dr. Sheena McGowan of Monash University describes the protein as a powerful bacterial killing machine. She says it looks like a flying saucer carrying a pair of warheads. It connects to the surface of the bacterium and then cuts through the outside to destroy it. Sheena McGowan says it could be highly valuable when conditions like pneumonia do not respond to traditional treatments. She says some antibiotics are not as effective as they used to be, and she urges that more research be done to develop safe drugs for humans. The researchers have been studying Ply-C's atomic structure to try to develop a drug. They say they have had success in treating streptococcal infections in mice, but an effective human treatment in the form of a pill or nasal spray may be at least 10 years away. For VOA Special English, I'm Alex Villarreal. This is the VOA Special English Health Report. World Breastfeeding Week was celebrated the first week of August. The celebration is now in its 19th year. It grew out of a meeting organized by UNICEF to find ways to support breastfeeding. Jill Hall supports breastfeeding. In fact, she could be feeding her son right now. She gave birth to Thomas, or Tiggy, as his parents call him, at a hospital in Washington 6 weeks ago. They live in nearby McLean, Virginia. Mother's milk is all that Tiggy will eat for the first 6 months. His mother plans to follow the advice of the World Health Organization. 6-week-old babies generally breastfeed 7 to 9 times in a 24-hour period. Jill Hall has 2 stepdaughters, but Thomas is her first experience with breastfeeding. And in her words, it's going great. She said, "It's pretty natural. You kind of learn from each other, mom and baby, how it's all going to work. And that can take a little bit of trial and error." Josie Tulo knows all about that. She works for a lactation consulting group in Fairfax, Virginia. She has more than 20 years of experience advising mothers. But she says babies themselves are great guides to nursing. She said when babies are born, they have a need to breastfeed. So, if we were to place a baby on the mother's abdomen, the baby would crawl up the mother's chest and choose which breast it would like to latch onto. The baby will open its mouth twice and lean in to grasp the breast. That is the mother's cue to hug the baby to the breast. Dr. Bernadette Dalemans is an expert on newborn and child health development for the World Health Organization. She offers estimates from the WHO and UNICEF about how many young lives could be saved through breastfeeding. She said, "We could save 1.5 million children under 5 years of age out of the 8.8 million that we estimate to die every year." This is if children were only breastfed for 6 months and continued to breastfeed for up to 2 years with additional food after 6 months. Breastfeeding reduces the chances of infections in the first few hours of life. Later, it reduces the chances of stomach and intestinal infections. Researchers say babies who are breastfed often grow up to have lower blood pressure and cholesterol as adults. They are less likely to be overweight and have type 2 diabetes. And that's the VOA Special English Health Report. I'm Alex Villarreal with the VOA Special English Health Report. World Suicide Prevention Day was September 10th. This year's observance was meant to bring attention to the differences among suicidal individuals and their situations around the world. But the organizers also said that all over the world, people have something in common. They need to feel connected to others for good mental health. The organizers included the International Association for Suicide Prevention and the World Health Organization. The World Health Organization says that every year about 1 million people kill themselves. It says suicide is one of the top 3 causes of death among people between the ages of 15 and 44. Among people aged 10 to 24, suicide is the second leading cause of death after road accidents. Lanny Berman is president of the International Association for Suicide Prevention. He points out that suicide rates differ from country to country, as do common ways that people kill themselves. As a result, he says prevention efforts must fit with local needs. He says the main methods of suicide in developing countries have been pesticides, pesticide poisoning, and overdose. And there have been efforts to develop prevention programs to reduce the use and availability of pesticides. Mr. Berman says findings from agricultural areas of Sri Lanka, India, and China show promise. They show that programs are helping to limit access to these poisons. There are often clear warning signs before a suicide attempt. Lanny Berman says individuals usually talk about the idea before they try it. Another warning sign, he says, is a sudden increase in the use of drugs or alcohol. Warning signs also include expressions of hopelessness or a sense of feeling trapped. Mr. Berman says the risk of suicide can be more difficult to identify in children. They generally communicate more with other children than with adults. But the other children often do not understand the messages. As a result, he says, when children speak of suicide, other children rarely report it. For VOA Special English, I'm Alex Villarreal. You can post comments on our website, voaspecialenglish.com. You can also find transcripts, MP3s, and podcasts of our programs. And you can find us on Facebook and Twitter at VOA Learning English.